Hello, I'm Joel Barthélemy. What do a famous Hollywood actress, a Pro Bowl NFL linebacker, and the star of a TV sitcom have in common? Well, Sharon Stone, Teddy Bruschi, and Frankie Muniz have all suffered strokes. Stone was just 43 years old when she suffered a near-fatal stroke after training for a 3-mile charity run. Bruschi, the former all-star linebacker for the New England Patriots, was 32 when he suffered a mild stroke just days after playing in the 2005 Pro Bowl. Muniz proudly says that he's never had an alcoholic drink, has avoided drugs his whole life, and has never smoked. And yet at the age of 26, he suffered his first transient ischemic attack, or mini stroke, while riding his motorcycle here in Scottsdale, Arizona in December of 2012. And not even 1 year later, he was back in the hospital after having a second episode. A popular myth is that stroke is a problem for the elderly. More than 664,000 Americans between the ages of 18 and 44 suffered strokes in 2010. Health experts say the number of stroke victims in that age group will likely double by the year 2030. In adults of any age, the majority of strokes are the kind caused by blockage in the blood supply in the brain. Fortunately, we can use clot-busting drugs in these cases to restore much of the debilitating effects of a stroke. And they work best if they're administered within 3 to 5 hours of the onset of symptoms. After that, the clot hardens, leaving a person with permanent life-changing disabilities. Since only a neurologist can prescribe drugs like TPA to break up stroke-causing clots, it's important to get a specialist as soon as possible. Transporting a patient by helicopter or ambulance to a big city hospital where a neurologist resides wastes precious time. Connected Health is playing a very important role in providing the right care to the right person at the right time. Tele-stroke networks like those the Mayo Clinic operates in Arizona, Minnesota, Florida, and soon parts of New England bring care to outlying areas where there is no neurologic care. A distant neurologist can assess a potential stroke patient during a live, real-time telemedicine visit at the patient's local rural hospital. If the diagnosis is stroke, the teleneurologist can order a course of clot-busting drugs started immediately. Making timely stroke care available via telemedicine is reducing deaths of people of all ages. It is also helping to prevent permanent disabilities that require 24-hour care in a skilled nursing facility for a patient's entire remaining life. Connected Health makes sense, and we need to make it available for people no matter where they live. I'm Joel Barthélemy. Your thoughts are very important to me. Please send me an email. My address is on this webpage.